The Edo State government has reported that one person is confirmed dead as a result of that disease. We were speaking with Professor George Akpede, the national chairman of the Lassa Fever Stakeholders Forum. Thank you once again for staying with us so we can talk to you properly. Now, you did say that do you have another figure different from what the Edo State Commissioner says, that one person is dead because of Lassa fever in Edo State?
From the data available, Iro Specialist Teaching Hospital, as I did say, 11 of 19 confirmed cases from November last year till date from Edo State. 6 of those 11 presented late, and they died soon after admission. But if you permit me, what I will say is this. Let's try and put this in context. It is not surprising that Nigeria has Lassa fever. It is also not surprising that there is an outbreak this year. Because as you've already said and has been well known, Lassa fever was first reported from this country in 1969. And particularly since 1989 or thereabout, there have been yearly epidemics. And if you bear in mind that this year's dry season is particularly severe indeed, more severe than a few past dry seasons. And there is an association between these outbreaks and severity of the dry season. Then it becomes obvious that the outbreak this year should not be a surprise to anyone. But within that, it is indeed sad and regrettable that we're still having deaths from Lassa fever. This, I say, it's sad and regrettable because if our country had been up and about in terms of outbreak preparedness, then our surveillance should have been able to pick these cases early enough, and following the diagnosis, the management of these cases would also have been reasonably adequate.
Okay, Professor.
Just a minute, let me finish to prevent the deaths.
Okay.
And indeed, particularly important, the level of sensitization of the public, as well as the level of sensitization of healthcare workers, should have been high enough such that there is a high index of suspicion, and at a season like this, cases should not be missed. And where cases occur, they are reported early enough to the appropriate authorities and appropriate response measures taken. Quite embarrassingly, as has been emphasized by the Honorable Minister, this had not been the case, which is why we're still having this number of deaths.
Professor, for a disease,
yes.
Professor, I quite know where you're coming from. For a disease that has vaccines, that can be vaccinated against and that can be prevented, it's not like the Ebola disease, but it is, we see similarities in terms of it's being hemorrhagic, the contagious nature of fluids from infected persons. Where is the Ministry of Health or the government getting it wrong?
Yes, let me quickly comment on something you said. Lassa fever so far has no vaccine. But unlike Ebola, specific treatment is available. That's ribavirin. And it's been available since 1989 or thereabout. Now, as to the question you asked, where are we as a country getting things wrong? I won't say just the Federal Ministry of Health alone. I will say all levels of government. At the federal, at the state, at the local levels, is in the area of outbreak preparedness. If our outbreak preparedness is all right, We will have active surveillance. We will have sufficient number of diagnostic centers around the country. Our citizens will be sensitized enough to know when Lassa fever should be suspected, when there are persons with fever. Certainly, the healthcare workers, in particular, the doctors, but also the nurses, and indeed every healthcare worker, will have a sufficiently high level of the high index of suspicion, so that when patients present with fever, the thoughts will not be going to malaria, and typhoid all the time. They will think about Lassa fever. And if by chance there is no active surveillance, but once Lassa fever is suspected, the requisite samples will be taken and sent to appropriate places, diagnostic centers in the country, and the diagnosis will be made.
Is there a cause for alarm right now? We asked this question to professionals a week ago, and we heard that if this and that and the other is done, everything will be fine. But now it seems to be escalating. How serious should it be taken?
I would say most seriously. Most seriously in the sense that the number of states so far that have reported or acknowledged Lassa fever this year, judging by previous experience and judging by the susceptibility maps of Lassa fever in Nigeria, is far below the number of susceptible states. Realistically, in fact, the whole country can be said to be at risk of Lassa fever.
Are you saying we run the risk of an epidemic?
We already have one, my good friend.
We have an epidemic. That's what you're saying. Categorically, there is an epidemic.
Mind you that for infections of this nature, even one case is regarded by the WHO, defined by the WHO as an epidemic. So a situation where you already have tens, possibly even hundreds of cases, we have a severe outbreak. I mean, put this again in context. In 2014, our country lost only 9 patients to Ebola, imported Ebola. We lost 9 out of 21 or thereabouts cases. Now already, this year, taking alone the cases that have been reported to the Federal Ministry of Health, over 80 cases, with about 43% of that number dying. Certainly more than what the number of persons lost to Ebola. So if you put it side by side, clearly we have a serious problem.
Professor, diagnostic centers are in short supply. Only one in the whole country?
No, not only one. We have Iroa Specialist Teaching Hospital. There's the one at the College of Medicine, the University of Lagos, operated by Professor Milabu. In Benin City, there's the Lahore Laboratories. And possible, I'm speaking now that in Abuja perhaps, and at the Federal Medical Center at Boeing, capable of making diagnosis. But we're not talking only of centers where they can make diagnosis. We're talking of diagnosis and treatment centers. Because as was emphasized earlier on, Lassa fever patients are not ones that you want managed in every clinic or
on that
hospital.
note, we'd like to cut in there because of time constraints. Thank you, Professor, for the information and the light you've shed on this issue. Professor George Akpede, the chairman of the National Institute of the Lassa Fever Stakeholders Forum. Interesting, BC, amongst some other things that he said, the number that he gave as for those confirmed dead in Edo State, 6. He said 6, that's according to him, but the Edo State Commissioner for Health says it's 1 person, so that disparity is there, and he's also...
We need some clarity there.
Yes, certainly we do to clear up that disparity, and also the fact that more diagnostic centers are needed, in addition to it needs to be taken more seriously so as not to be taken for granted.